Peace and blessings, family. Peace and blessings. I'm your brother, Sean Ali. Here, Supreme Health and Fitness by Sean Ali. Um, I thank everybody for tuning in now and later. This message, I pray as always that it is received in the spirit that am delivering it, which is as your brother, which is in the spirit of love, which is in the spirit of God. Um, Tonight, I briefly want to go into a serious topic. And last year, they have found that they have changed the third leading cause, and they have over 250,000 people in 2016 lost their lives from medical errors. And this has superseded the death. The previous third leading cause was respiratory disorders, and 200,000 people died last year from respiratory disorders. So the CDC has concluded that the new third leading cause of death is medical errors. So tonight I want to talk about how that impacts the Black nation and the importance and the need for us to develop our own. I want to set the tone with, this is a report on Black demographics. And I just want to lay the foundation for our current health care, the current status of our health care. And it says that Black men 20 years and over who are overweight, 71%. 71% of Black men 20 years and over are overweight. Black women 20 years and over who are overweight, 79%. Black men 20 years and over with hypertension, 41%. Black women 20 years and over with hypertension, 44%. Now this is going into the health risk factors, and this is dealing with access to health care. And it says that Black persons under 65 years without health insurance, almost 19%. 18 and over without a usual source of health care, 21.5%. Black children under 18 without a usual source of health care is 5.9%. So this is saying that when they take a look at the Black nation's access to health care, not only are we underinsured, but our access to just usual regular health care is far below that of anybody else's. And this section is entitled African American Life Expectancy. And it says that the African American death rates are directly related to the state of Black America. America is experiencing a crisis in health care, obesity, cancer, and other chronic and seriously fatal illnesses. It says this crisis, like most others, has a greater effect in the Black community. Now listen, they have less access to appropriate health care, and that includes preventive care for children and adults. It says, so African Americans are not only more susceptible to the diseases and illnesses, they are also more likely to die from them. It says, listen, even when the incident rate is lower for a particular disease such as leukemia, Black death rates are higher due to lack of access of appropriate health care. Now listen to me, family. This is saying that our life expectancy here in America is based upon how Black America as a whole is treated. And it's saying that when there is a crisis in America, that it hits the Black people, it hits us higher than it does anybody else. It affects us more than anybody else. So when the CDC comes out and they says that John Hopkins says that studies suggest medical errors now the third leading cause of death in the U.S. When they classify this as an epidemic, according to this study, according to the black demographics, because these crises are hit us harder. These numbers of death, this 250,000 people that lost, the estimated 250,000 people that lost their lives last year due to medical errors. A significant number of them came from the black community. It says, so African Americans are not only more susceptible to disease and illnesses, they are more likely to die from them. It says that the crisis, like most others, have a greater effect in the black community. They have less access to appropriate health care. So this means that these doctors that were misdiagnosing people, they are not considered appropriate health care. So guess who they were practicing these misdiagnoses on? Guess who they were preying on? They estimated 12 million people were misdiagnosed last year. Listen to me, family. 12 million people were misdiagnosed last year. And guess who had access to this inappropriate health care? They just said we lack access to appropriate, to usual sources of health care. So when we look at the crisis, the epidemic of the third leading cause of death being misdiagnosed medical error, heart disease, the #1 killer. Over 633,000 people died last year. Black people lead in heart disease. Cancer. We develop cancer at a significant rate compared to others, compared to our 14.7% of the population. We die from look, this demographic says, even when the incident rate is lower for a particular disease such as leukemia, the black death rates are higher due to lack of access to appropriate health care. See, listen to me. I want us to understand. We lead in cancer. We lead in diabetes, hypertension, high blood pressure. We lead in obesity. So when they say the third leading cause of death is now medical errors, how do we not expect to be leading in that when we lead in all other causes? They said if leukemia is curable, but if a black person gets it, we are more likely to die from leukemia because we do not have access to appropriate medical attention. That means we are suffering from misdiagnosis and medical errors. So when you take yourself or your children to the doctors, when you take them to your healthcare provider, you and I, we have a significant chance of being misdiagnosed or suffering from a medical error, and it is killing us. 250,000 people lost their lives last year from medical errors. And listen to me. This is what they're saying. They're saying that 10%, and this is from John Hopkins, 10% of all U.S. deaths are now due to medical error. The third highest cause of death in the U.S. is medical error. Medical errors are an under-recognized cause of death. It goes into, it says, John Hopkins patient safety experts have calculated that more than 250,000 deaths per year are due to medical error in the U.S. Man, listen to me, family. They have articles. See, so you and I, we must understand that we need to develop our own understandings of healing, health, life, and science, because we are in the category to receive the most inappropriate health care available. They have an article in the New York Times, The Case for Black Doctors. This was published in the New York Times, and they say in this right here, they said the infant mortality rate in the Black population is twice that of whites, meaning our babies are likely to die 2 times more than white people. Why? Because we receive inadequate, inappropriate medical attention. It says now, Black men are 7 times more likely than white men to receive a diagnosis of HIV. Wow. And more than twice as likely to die from prostate cancer. Black women have a nearly double the obesity rate of white women and are 40% more likely to die from breast cancer. Black people experience much higher rates of hypertension, diabetes, and stroke. And it says the list goes on and on. Listen to me. Because, like the Black demographic says, that when a crisis hits, because we are at the bottom of the barrel, because we are relegated still as property, as former slaves, the 13th Amendment did not stop slavery. It is one sentence long. It says that slavery will be abolished in America in the territories except a person is duly convicted and therefore they are reverted back into slavery. So they didn't change their understanding or their outlook on us. They just manipulated us. So they don't still look at us no more than 3/5 of the human being. They don't still look at us as property. They didn't go back and change none of this stuff. So when we have access, when they can tell us, these are government reports that tell us that we have the worst access to doctors, that the health care we receive is the poorest in the nation, and we are only 14.7% of the population. So family, this message is examining death by doctors, medical errors as the 3rd leading cause of death, understanding the impact on Black health and why we need our own. They got it. Look, this is from the CDC. It says doctors told to, this how corrupt the medical system is. Listen to me. They not practicing healing. They are practicing medicine, which means they want to test these pills out on you to see if they work. They are not practicing health care. They are not practicing healing or restoration or rejuvenation. They are practicing medicine. That is a big difference. Now this is just an article so I can show. It says doctors are told to avoid prescribing opiates. It says the opening sentence. It says the nation's top federal health agency urged doctors to avoid prescribing powerful opiate painkillers for patients with chronic pain, saying that the risk far out of the drugs far outweigh the benefits that it can give you. See, they are saying that, listen to me, they are warning doctors. They saying that these drugs, that these painkillers don't work. That if you get a prescription for a pills for 30 days, that they killing you, that they overdosing you. Listen to me, family. It says about 40 Americans. Listen, about 40 Americans die each day. About 40 Americans die each day from overdosing on prescription painkillers, according to the CDC. And this is in 2013, an estimated 1.9 million people abused or were dependent on prescription opiates. Now, it says we know of no other medication routinely used for a non-fatal condition that kills patients as frequently. They saying that they have not, out of all the medicines, they have never encountered a prescription for a non-fatal illness that is killing as many people as these doctors prescribing pain medication. They ain't trying to heal you, man. That's why we gotta get out of this, and we have to understand that nobody can heal us better than us, and we need to develop our own. We need our own. Listen, family. For the first time, the federal government is communicating clearly that the widespread practice of treating common pain conditions with long-time opiates is inappropriate. Listen, man, the CDC is making it perfectly clear that medical practice needs to change because we are harming pain patients and fueling a public health crisis. Now listen, the key word, listen now, it says in fueling a public health crisis. Now, according to the black demographic, when they listen, this crisis, like most others, has a greater effect in the black community. They have less access to appropriate health care. So when they tell us about these health crises that's happening here in America, we have to understand that because of the way we are already treated in America, we suffer from these crises more than anybody else. So when you go to your doctor and you say, "Doc, I got a pain. It hurts here, 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 here," and they want to give you an opiate, they are not trying to heal you. They are strictly pimping you. They trying to get you hooked on that pharmaceutical so you can come back, because they don't heal the cause of your pain. They block the pain. So they say that in all of this time, they say, "Man, look, we know of no other medication routinely used for a non-fatal condition that kills patients as frequently as opiates." See, they killing us. Look, listen, the CDC, healthcare pros killing patients by not washing hands half enough. Listen to me, family. Listen to me. I don't care what nobody say. I don't care how you feel. I don't care how you think. Go and do your research on how the Europeans made it illegal to shower or bath on any day but Saturday. They thought it was a sin to take a bath. They said Queen Elizabeth only washed up her ass twice on her marriage, and I think before she died. So these Europeans that treating you, they come from a tradition where they don't believe in washing up. That they thought it was a sin only a few hundred years ago when we came and pulled them out of the dark ages. So the CDC has put out an alert saying healthcare pros killing patients by not washing their hands enough. Patients are dying because healthcare professionals don't wash their hands half enough. So a new CDC campaign reminds docs, nurses that clean hands count. So when you walk into your doctor's office and you see that flyer on the wall that says clean hands count, that's because they have to remind them to wash their hands because they are killing us. spread these diseases, using the bathroom, not washing their hands, treating patient to patient and not washing their hands. So the CDC had to reissue a campaign to remind the doctors, nurses, and healthcare professionals to wash their hands, not because they are killing us. So whenever there is a crisis, remember what the Black demographic said about crises, that when we encounter a crisis, the Black community, it hits us hard because we have the less access to quality and appropriate health care. So when these dirty doctors, when these dirty nurses, when they are practicing these filthy habits, they practicing on us. So when they say 250,000 people died last year from medical errors, a majority of those 250,000 came from the Black community. So you and I, we have to make a decision about ourselves. We have to make a decision about ourselves. You have to make a decision about your children, about your husband, your wife, your parents, your grandparents, your aunts, your cousins, your nieces, that we have to come up with our own. That we must develop our own abilities of healing, health, life, and science. And we got to go and accept it. Man, we got to go and accept it. See, listen to me. When doctors kill patients to harvest their organs, look, see, listen to me. Listen, whenever there is a crisis, remember who is at the root of that crisis. Remember that the government has said, because of our condition and our lack, that whenever there is a crisis, it is developed and hit hardest in the Black community. So this is incumbent upon us. This is incumbent upon us to take charge of our own nation. To take charge of our own nation. Man, I'm telling you, family, listen to me. Look, Dr. Death. They named her Dr. Death. Man, look, they said this doctor, man, they classify her, the attorney general said, the complaint said Nicholas's excessive prescribing showed a depraved mind and a lack of regard for human life, which leads to these deaths. They call her Dr. Death. Guess who she praying on? Guess who they practicing this death on? See, nurses who kill. Look, do your research. Look, these are nurses. They are responsible for killing patients. See, they got a list of them. They put, man, look, they got a, and for those that's in the New Jersey area, look up Charles Cullen. Charles Cullen. They let him practice his murderous spree for years. What they do is they take these nurses and they shuffle them. They move them from hospital to hospital. They have an outlook on, hold on, family, let me find this for you. Listen, they got, listen to me, fam. Listen to me now. Listen to me now. Woo! Boy. Look. Nurses, male and female, comprise 80% of healthcare serial killers. Nurses, male and female, comprise 80% of healthcare serial killers, and the number of suspicious deaths attributed to healthcare deaths. Now listen, they got a list of, this is a list of the characteristics of a healthcare serial killer. They had, so if they passed this list out to different hospitals and doctor offices as a way to identify a serial killer in their midst. And they said we're giving nicknames like Death Angel and the Terminator. So if you got a nurse, or if you hear a nurse in that hospital that has one of them vicious nicknames, that's number one. We're seeing entering rooms where unexpected deaths occurred, had moved often from one facility to another, were secretive, had persistently difficult with personnel, like to be present when a patient would die. See, they have examined these people. They got, the list goes on. See, they got a whole other list of characteristics of these people that like to kill. They get into the profession just so they can kill. So whenever there is a crisis, remember what the black demographic said, that because we have the worst access, we are at the heart of every crisis. So when you go to take yourself or your child, when we go to take our children, they are our future. When we go to take our children, we putting our children in these monsters' hands. They leave, come back, and inject our children with we don't know what. And then they suffer worse. Our parents, man, family. Look, I appreciate everybody for tuning in. I appreciate your comments. I appreciate you coming in and getting some of this information. I just wanted us to understand, examining death by doctors, that this is real, that they have now elevated the third leading cause. The Washington Post, researchers, medical errors, now the third leading cause of death in the U.S. 12 million Americans misdiagnosed each year. See, studies suggest medical errors now the third leading cause in the and here. See, they have put articles on this. See, medical errors are now the third cause of, see, and they say that the case for black doctors, because you and I, we lack appropriate. That's their word. They say we lack appropriate access to appropriate medical attention. So when they say that there's a crisis that's hitting, we get it worse. So when this third leading cause, they hitting us. They hitting your family. They hitting your children. They not curing black people from cancer. Sisters, y'all developing and dying from breast cancer. Brothers, we developing and dying from prostate cancer and colon cancer. I don't know if they're killing us, but I know that they're not trying to heal us. I do know that. I don't know if they're killing us, but I do know that they don't give a hell about us, and they damn sure ain't trying to heal us. So let us understand, examining death by doctors. They killing us, family. They harvesting. When doctors kill patients to harvest their organs. This is their research. This is from the government. Looking at the deaths and saying, man, guess who bodies they harvesting? Guess who organs they trying to get? We got the best. We got the best. So if they need a heart, if they need a kidney, if they need a liver, if they need bone marrow, if they trying to get stem cells, they don't go to another European. They go get yours. They get your children. They get your mom and your dad. They get mine. So we need to understand the impact of the third leading cause of death on the black nation. We got to know our place in this third leading cause. And then we got to take a look and we got to say, hold up, y'all not killing us no more. I'm not putting myself or my children or my family in your deadly hands anymore. And then we go and we accept our own and be ourselves. And we go to our black healers. We go to our black healthcare professionals. We go to our black healers. And we accept black science. We accept black excellence. We accept the fact that we can heal ourselves. We can heal ourselves. We can heal ourselves. We can heal ourselves, man. Man, I love y'all, family. I thank everybody for tuning in. Tomorrow, Sister Denise Renee Muhammad and myself, we will, at 8 p.m. Eastern, 7 p.m. Central, we will be going live with the Health and Wellness Power Hour, and we will be going into the state of the black health, and we will be going into solutions. And the number one solution is to accept your own and be yourself. Accept your own and be yourself. So I thank you all for tuning in. I just wanted to open our eyes. They have elevated the third leading cause of death to being from medical errors. And they have taken a look and they say that you and I, because of our lack of access to appropriate medical professionals and care, we are the leading members of the 250,000 people that died last year. Man. Thank you, family. I'm your brother, Supreme Health and Fitness by Sean Ali. You can go to my site, www.Sean Ali Wellness Program, and you can open the door to solutions for yourself and your family. And you can tune in tomorrow to the Health and Wellness Power Hour, and you can ask your questions, and you might get a solution, because we definitely have solutions. Oh, yes, we do. Listen, family, we definitely got solutions, because there are many black people that have dedicated their time, their energy, their life to becoming healers. All we got to do is accept it. Just accept it. Accept your own and be yourself. Accept your black excellence. Accept black science. Accept black doctors. Let's go, family. Let's get ourselves out of the death grip. Let's get ourselves out of the death grip of these monsters that we call doctors. So I leave you as I came, in the greeting words of peace, in the Arabic vernacular. Assalamu alaikum. Hotep. Black power. Power to the people. And let's go. Let's live. Let's be great. I love you. I thank you. I'm your brother. Peace, family.